everybody, my name is Rebecca Storlie, and I am going to talk to you today about my summer project, the development of a novel goat kid health scoring system. The dairy goat industry in the United States contributes significantly to the overall goat industry within the U.S. and has reported consistent growth in animal number over the past couple of years. Unfortunately, within this industry, we see a very wide variation between operations in animal health monitoring systems in pre-weaned goat kids. And we also see that gastrointestinal and respiratory diseases play a key factor in contributing to kid welfare and farm economic losses in pre-weaned goat kids. We have seen similar challenges within the bovine dairy industry, and have also seen that when health scoring systems are implemented in pre-weaned calves, that these systems have proven to identify respiratory disease early and have allowed for improved health screening and management on farms. Because of this, we aim to develop a similar health scoring system for pre-weaned goat kids in order to promote early identification and management of these diseases within the dairy goat industry. We created a health scoring system that has two primary objectives. First, we created this system to be able to assess the overall health of an entire goat kid population. We also created this system so it has the ability to also identify individual goat kids who are in need of medical attention. And we created this system with the idea that it will be able to assess a large number of goats in a very efficient and reliable manner. Our system that we created includes 6 categories: mentation, body posture, respiratory secretions, belly fill, fecal score, and temperature. When assessing an individual kid, the individual kid is scored on a range of 0 to 2 within each category. A kid given a score of 0 is a very happy, healthy kid that does not need any kind of medical attention. And a kid given a score of 2 is a kid that needs medical attention in a very timely manner because they are very sick. When the kid is scored in each of the 6 categories, their total cumulative health score is then calculated, and that health score can be used to determine if the kid needs medical attention or not. We are currently in the process of validating this system and have sent it out to multiple experts within the dairy goat industry, including veterinarians and extension specialists, for their review and for their feedback. We then plan to continue validating this process this fall, and our goal for validation is to determine if this scoring system is actually accurate. Does it accurately and reliably identify kids who are in need of medical attention? We also want to determine if this scoring system is consistent between evaluators. If 10 veterinarians are going to be assessing one single goat, are they going to be giving that goat the same score? That's basically what we're looking for. We're looking for consistency between evaluators. In summary, we believe that this goat kid health scoring system will help promote early identification of respiratory and gastrointestinal disease in goat kids. We believe that it will serve as a very invaluable training tool when working with producers and veterinarians, and that it will act as a resource for an increase in young stock welfare and reduction in farm economic losses within the dairy goat industry. And we believe that it can be used both on very large-scale operations, but also on small hobby farms and in research settings. We also hope that this system, once it becomes more widely used within the dairy goat industry, will also be able to be validated and used within other types of goats, including meat goats and fiber goats, and also potentially in other species of small ruminants, such as lambs. We look forward to its continued validation and use within the small ruminant industry, and we look forward to see what the impact it has on reducing disease in pre-weaned goat kids within the dairy goat industry. Thank you so much for your time. If you have any questions, feel free to email me.